My article today falls under the category of science and health. It's about organ donations. Anytime I have an opportunity to talk about my organs, I'm a happy camper. Organ donations from marijuana users pose no significant infectious risk, study finds. A new federally funded study examining the possible risks of organ donations by marijuana users found no indication that recent cannabis use increases the likelihood of significant side effects in the year immediately after transplant, even as many healthcare providers continue to restrict transplants to cannabis consumers. Findings of the research, which looked at rates of infection, transplant failures, and death among recipients, suggest that organs from donors with a history of recent marijuana use do not pose significant infectious risks in the early post-transplant period. Despite concern that donor exposure to marijuana increased the risk of fungal infections in recipients, our study found that a donor history of marijuana use did not increase, 1, the likelihood of donor culture positivity, including respiratory cultures, or 2, the risk of early recipient bacterial or fungal infection, graft failure, or death post-transplant, authors wrote. Even when evaluating only lung recipients, there remained no association between donor marijuana use and the risk of post-transplant infection. As more states have legalized marijuana, reported rates of use among adults has also risen, notes the new study published late last month in the American Journal of Transplantation. It is likely that a growing proportion of deceased organ donors have a history of marijuana use as well, it says, though this metric has not been specifically reported. Our data suggests that organs from donors with a history of recent marijuana use do not pose significant infectious risk in the early post-transplant period. Infections are a main concern. It continues, pointing out that past findings that marijuana leaves themselves can be contaminated with potentially dangerous bacteria and fungi. Inhaled marijuana has been associated with certain infections among transplant recipients, while bacterial outbreaks have also been linked to marijuana use among the non-transplant population. What has been less clear is whether organs from marijuana users could pose significant risk to transplant recipients. Whether a deceased organ donor with a history of marijuana use poses risk to the SOT, the solid organ transplant recipient, has not been clearly evaluated, the paper says, and no studies have determined that the impact of SOT donor marijuana use on donor culture results and the risk of donor-derived infection, DDI, among recipients. The goal of our study, the authors wrote, is to better characterize the infection risks that marijuana use among deceased organ donors may pose to SOT recipients. Conducted by researchers at the University of Pennsylvania, University of California, San Francisco, Temple University, and the Gift of Life Donor Program, the study looked at data from 3 transplant centers in Philadelphia. It included transplants between Jan 1-15 and June 30th, 2016, involving organs procured by the Gift of Life program. The research was funded by the National Institute of Health, Center for Disease Control and Prevention, and Transplant Foundation's Innovative Research Grant Program. Transplants were defined as coming from a recent marijuana user, either if a toxicology screening showed the presence of THC or if next of kin donor information reported that the donor had a history of cannabis use within the last 12 months. Analyzing data from hundreds of organ transplants, researchers assessed 3 primary outcomes: whether cultures from donors themselves tested positive for bacterial or fungal infection, whether organ recipient developed a new bacterial or invasive fungal infections, and whether the transplant resulted in either graft failure or the recipient's death. For each outcome, they found no significant increase in risk involving donors with a recent history of cannabis use. Among donors with a history of recent marijuana use, 79, that was 79 out of the group, 89% of the total group, had at least one positive culture, compared with 264 or 87% among those with no history of marijuana use, it says. For example, on donor respiratory cultures, 76, which was 85% of the donors with a recent history of marijuana use, and 250, 82% of the donors with no history of recent marijuana use had bacterial or fungal growth on respiratory cultures. On both unadjusted analysis and multivariable analysis, there was no association between recent donor marijuana use and donor culture positivity. Notably, the study did not account for the amount or duration of marijuana use by donors. It also had a smaller cohort of lung transplant recipients than past studies, which authors note have shown mixed results. The report acknowledges that relying on interviews with next of kin or donor informants was an imperfect measure of a donor's actual cannabis use, though they added that when we limited the exposed group to those with a positive toxicology screen for THC, there remained no association with donor culture results or recipient outcomes. In conclusion, they wrote, our study demonstrates that donors with a history of recent marijuana use are not more likely to have positive donor cultures, and their recipients are not more likely to develop a bacterial or fungal infection, graft failure, or death in the early post-transplant period in the context of current management. These results suggest that organs from donors with a history of recent marijuana use do not pose significant novel infectious risks to recipients in the early post-transplant period. Current guidance around cannabis use and organ donation is inconsistent. As noted in a recent review by a student fellow at the Petrie-Flom Center at Harvard Law School, the U.S. Organ Procurement and Network defers decisions on transplant eligibility to each transplant center. It says, though, in practice, many marijuana users are deemed ineligible. Many transplant centers prevent cannabis users from receiving solid organ transplantation due to concerns regarding interactions between cannabis and immunosuppressant drugs used for transplant treatment, non-adherence, fungal infections, and neuropsychiatric effects, the review says. But the latest study is among a growing body of work pushing back against that policy. Although larger scale studies are needed to validate these findings, these studies suggest that medical cannabis use should not be an absolute contraindication to solid organ transplantation, the Harvard says. Research has also suggested that THC, a component of cannabis, might actually help to prevent transplant rejection. Oh, that's like a medical mic drop. As for actually identifying recent cannabis use, at least 2 recent developments are expected to allow researchers to test subjects with more precision. Researchers behind a federally funded study recently said they developed new procedures to enhance the selectivity of a popular forensic test method, allowing better detection of Delta-9 THC and its metabolites in blood. The federal government also funded separate, recently published research identifying a promising new method to test for recent marijuana use. That study, funded in part by the National Institute of Drug Abuse, determined that more accurate methods of testing than currently used is by analyzing the molar metabolite ratio of THC to THC-C00H in the blood. The research is part of the growing call for more precise and reliable ways to measure recent marijuana use and impairment, often around driving, as more jurisdictions legalize the drug. So this is Yarrow Kubrin, High at 9 News. And before I hand this topic and this news story back to my fellow panelists, I wanted to just say that I have been donating my organs to my wife for 17 years, and there has been no recipient rejection. I do think that it is important as we normalize cannabis to make sure that recipients of organs have the widest possible donor pool. And if the science supports not rejecting organs from cannabis users, that is obviously a good thing for patients and people who need somebody else's body parts. This is Yarrow Kubrin, High at 9 News. I'd like to hear what you guys think.
This is one of those, when you find it out, you go, yeah, well, no shit, Sherlock.
This is the best news. The
thought that you would not take someone's heart-lung transplant donation because they may have recently smoked weed is just an incredible question to ask. Then you find out, well, without weed, they have more problems when you don't smoke weed than you do, and it's still a very small problem. It should be the answer to the question, but apparently it's not. The bigger concern is once you put that transplant into a human body, you go on to immunosuppressive drugs. Now, I wouldn't recommend anybody smoke weed when they're on those drugs. So you just do tinctures, you use edibles, how you titrate it, and the route of administration becomes very important. But it should not interfere with your ability to harvest these organs or to transplant them. It just seems this is like, oh, the children. Yeah, well, there's no evidence the children are hurt either. So stop throwing that kind of horseshit out there to stop people from getting their appropriate medical care.
Mm-hmm. I think this is fantastic news all the way around. This is fantastic news for people that want to give organs. and would have been discriminated against because of their cannabis use. I've seen that happen. And then also too, for patients that need organ transplants, now they're going to have a larger pool to be able to find the organs that they need. But I had a very good friend of mine who suffered from kidney dialysis failure, and he at one point he ended up getting a kidney, and I remember how much they were making him stop smoking cannabis and everything, and cannabis was the devil and all of this and that, and they were going to make him ineligible, and he was going to get dropped back down to the bottom of the list if he didn't quit smoking and this and that. And he ultimately ended up getting that kidney transplant, and everything was good for a while, but that kidney had a cancer in it too, and that ultimately killed him.
But how do you check for that without slicing the kidney open? And that sort of defeats the purpose of putting a whole kidney into somebody.
Yeah.
Oh.
Yeah.
And they probably don't have they probably don't have a very good return policy on those kidneys either.
No, there's definitely a no exchange policy, but at the same time too, once you give it, there's no givey backs either.
Yeah.
Well, and the immunosuppressive drugs will put a cancer on steroids, okay, if it's in there. And the person they took it out of was still fighting it in their immune system, but you put it into a recipient, and these immunosuppressive drugs stop the rejection process, and that's the same process that goes and kills cancers or fights against them. So it's sort of a self-defeating circle here. And how do you find a cancer inside of a donated organ without slicing it open? It's sort of the risk you take. But if somebody gets these drugs and you're having problems with them, taking tinctures or edibles to deal with the side effects of the immunosuppressive drugs, I mean, I wouldn't smoke weed, but tinctures and edibles would certainly be something I'd recommend in the medical community for fighting the effects of these immunosuppressive drugs.
I mean, I don't mean to hit below the belt, but if we're going to talk about delivery systems for medical patients, suppositories are probably one of the best ways, especially for seniors and especially for people who might not be familiar with cannabis in general. But jokes aside, I think the challenge here is simply the article that we talked about earlier, which is it's not about the information that's being generated. It's about how quickly does that waterfall into changes in policy. And what this article talks about was how many of these organ donation or organ transplant centers make up their own policies. And so how long does it take before this data filters down and they change those policies, which increases the pool of eligible donors, eligible organs for transplant, and really creates a better outcome for patients? And that's my concern, because if it takes years, that's a problem, right? We don't live in the information age anymore. We live in, there's so much information, people have problems processing it and then taking action based on that new data. And my concern is just that some of these studies could get lost in the noise, steady drumbeat of information. And I mean, at the end of the day, if it doesn't change policies at organ donor locations, then so what?
Yeah, Yarrow, I think you have some really, really great points there. I think we're in more of a new world for all you book aficionados out there. So there's more of a new world than in 1984 that everybody likes to allude to. We got way too many choices and way too much information out there. Like, the more that stories like this get out, the more studies that these drown out the other ones, like, hopefully it will push forward the science instead of the hysteria. When it comes to stuff like this, like Dale said, this is a no-brainer, 100%, no shit. Just like when they lifted the ban on gay and bisexual men donating blood in December, right? Like, all of this mass hysteria, this nation is built on emotion and not off of logic, and we need to move into a more logic-based society when it comes to medicine and people getting access to it.
Good luck with that.
I agree with you.
Good luck with that.
I agree with you on that, Rico. But Yarrow, you know, I agree with you too. The the suppositories are a great way You know what I'm saying? So I just don't understand why more people just don't keister it. I mean, it works for everybody in prison. And we're gonna go to commercial.
Because we're Americans, and we're a little puritanical, and in other countries that's a more accepted medical delivery. You know, hey, look,
it's changing. You heard about all these kids butt chugging shit, like that's just it's coming,
goodness.
man.
Oh,
as our generations continue to die out, man, I think tomorrow will be a brighter day when it comes to suppositories.
I like to keep an open mind. I don't like to keep an open sphincter, and I just think that in general, Americans are a little resistant to that form of receiving medication. But I do think for the senior community, and I'm sorry, the pepper plug, I have to bring your grandfather's sphincter into the conversation, but I do think for the senior community, there may be some resistance to vaping or charging batteries. There may be some resistance to tinctures that taste very herbaceous and have a high alcohol content. There may be some resistance to smoking, and obviously edibles can be hard for people to make sure that they don't overdose themselves. But I do think that fast acting through that digestive system and up the keister is probably the most senior compatible delivery approach for medical outcomes.
So Rico,
when it comes to suppositories, don't hate, dilate.
So Rico, what it really is basically Yarrow is trying to transform everyone's grandparents into conquistadors.
Hey, man.
Oh my. Keister doors.
Exactly.
Okay, I see.
You see what I did there?